from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
9:08 is the time. We're back with our sponsor, Baptist Health, and they want to keep on amazing, want you to always keep on amazing. And we're so excited to have a familiar face in the studio with us this morning. Give us some advice, really good advice, especially for our older Arkansans. Joining us this morning, Kristen Belew, a pharmacist with Practice Plus, the network of family practice clinics with Baptist Health. And Kristen, good morning to you. Thanks for being here. Really appreciate you stopping by.
Yes,
different reasons you come in here in the studio all the time. And this is a very important one. And I know that Baptist Health is really focusing on this for 2018, setting goals. So can you tell us about what those goals are and why they want to focus on something like this?
That's exactly right. So Baptist Health is putting a lot of intentional effort into taking care of our elderly population. And so one of the job responsibilities that I have is working with the population under Medicare, so ages 65 and older, and reviewing their medications just once a year to make sure that everything that they're taking is still safe and still appropriate for their age.
We all know there are dangers associated with medications out there. So what are some of the main things you guys try to focus on whenever you're talking with those patients or their loved ones who care for them at home?
Sure. So one thing we want to consider is how your body changes. As we age, your body changes, particularly with drug metabolism, whether that has to do with weight gain or weight loss or kidney function or liver function. So we just reevaluate for dosing. We also want to consider any medication that may make you a little bit drowsy or confused or lightheaded. That may lead to an increased risk in falling, and that's something we definitely want to avoid.
Okay, falling. That's a danger that, you know, there are commercials about that because it's one that can be deadly at times.
Of course.
Unfortunately, we don't typically associate that. You know, younger generations don't think about it that much, but I mean that's something that is a real danger. It happens far too often. I know we have a picture that you want to show today. Yes, and this is a very important, very special picture to you, right?
Yes. So we have a picture actually of my papa. And he had a hard fall over Christmas and broke his ankle.
Oh, wow.
He's doing much better. I think you can see he's giving us a thumbs up in the picture, but it's also his birthday, so I wanted to give him a shout out to say happy birthday to Papa.
Fantastic. Happy birthday to Papa. Yeah, you can see his picture there. It's something, when that happened and your family, like what happened? What was going on through your family's minds, your parents, you? How did you guys, you know, take the appropriate action after that?
One of the first questions that came up was, what about his medications? Did one of those medications make him lightheaded or dizzy? And so, it was a conversation that we had, and it's just something you want to take extra precaution with.
Let's talk about over-the-counter medications. There are a multitude of those. I mean, you go through any of the pharmacy aisles, and you'll see a lot of them out there, and a lot of them are available. What are some of the things people need to keep in mind about those?
So some people don't realize that Benadryl actually is on the list of not recommended medications for the elderly.
Oh.
And the reason why is because some research says up to 24 hours after taking one dose with Benadryl can actually cause a decrease in stabilization and balance. And so we recommend alternatives such as Zyrtec or Claritin, which may be less drowsy to treat allergy symptoms, or melatonin for sleep if you are taking Benadryl for sleep.
Something other than the Benadryl medication, which you're right, there's been a lot of research done on that over the years that have shown that it is a risk. It's not something that happens to everybody, but risky enough to where you would say avoid it, right?
Sure, and that does include like Tylenol PM, Advil PM. Both of those products have Benadryl in that product as well.
Extremely popular medications too. So easy to right there in eyesight view, you know, the line of your sight where you just grab them off the shelf. Make sure you don't do that for patients older than 65. Okay, any other tips you would suggest to folks out there, especially family or caregivers out there, to maybe help their loved one maybe not go through an experience, unfortunately, like your grandfather had to go through?
That's right. So there are multiple health conditions that I would take caution with and speak to your doctor or your pharmacist if any of these may be happening to you. Things like getting up in the middle of the night, whether it's using the bathroom or sleepwalking. Talk to your doctor about that. If you're a diabetic, you want to be really careful not to have low sugar levels. So we don't want to get under 100. And also, if you have any numbness or tingling in your feet, that may lead to an increased risk of falling as well. And then, of course, if your medications make you drowsy, confused, lightheaded, all of those things, we want you to talk to a healthcare professional.
signs are out there too. Like, you can feel those things. So if you feel those symptoms, make sure you talk with your healthcare professional. You can always talk with the folks, of course, at Baptist Health. You can contact them at 1-888-BAPTIST. You can also go to their website, baptist-health.com. Kristen, thanks so much for coming in today. Appreciate you stopping by.